for our conditions, this type of insurance and
these offices are not gonna cut it for us.
No. Everyone. So, hello. If you guys haven't saw my last vlog, it was about insurance update because a lot of you guys were concerned, wanted to know what was going on.
If you haven't seen that video to get context into what this one we're going to lead into, please watch that one so you understand.
Thank you, honey bunch. So for this vlog, we're going to talk about the insurance we have and the horrible doctor stories we have accumulated since January, February. 3 months. I mean, these stories are atrocious.
First, let me just tell you this. Me and Janice have been dealing with our chronic health issues for many years, obviously. So we already kind of have the baseline and know what kind of doctors we need to see. I know I need to see a GI. Janice knows she needs to see a cardiologist. Those are some of the doctors that we see on a regular basis. Now, for me, for example, I am at a higher risk of cancer and so on and so forth because of the medications that I take. So one of the things that my GI told me, I have to see a dermatologist every single year. Perfect. Remember that detail as we continue in the story later on. So first and foremost, we had to get our new primary care because our old one was not in network of our new insurance. So we found a company, it's a big one, they have several offices, many doctors, and you know, my insurance company was like, yeah, no, this is part of our thing, it's really
They're great!
Yeah. So we made a new patient appointment for Janice. So she was the first one to go in. We went in. Medical office is really nice. Everything is brand new.
Beautiful.
Looks really nice. We're like, okay, perfect, no big deal. And some of their medical offices are also urgent cares.
Yeah.
So it's a very beneficial big office that they can do lots of different things. So Janice, we did all the paperwork. She gets called into the back. Obviously, she has Orion with her, and I always go in all of the doctor's appointments with her. That's how our dynamic has been for
caretaker
years and years. We walk into the back, and one of the nurses goes, first of all, she goes, she's looking at me, she's like, you can't come back here. The doctors only see the patient alone. And we just go, well, I'm her caretaker. I am in the appointments always because I help her. She may not remember some details or anything like that. Like, this is why I'm here. Oh, okay. Then they look down, they see Orion, they go, he can't come in. Now, instead of jumping down people's throats, first we go, well, it's okay. He's a service dog. He's allowed to go anywhere. Think of him as a wheelchair. He's medical equipment. And they go, yeah, well, it's still a dog, and there are people back here who have allergies, so he can't come in. Orion's not here for fun. He is here to do a job, and that job is to protect Janice from having any issues. So I tell them, I was like, listen, I understand, but he is medical equipment. He is not a pet. He is here to work. You know what I mean? And they're like, okay, well, we'll have to ask the doctor to see if it's okay with him. And the nurse is walking away, and I'm like, no, it's not if it's okay. If it's not okay, we're leaving, and we can call the police, because if you don't know, in the state of Florida, it is actually a misdemeanor crime to deny access to a service dog. So the person who says, you can't come in, that person can end up in handcuffs and be going to jail.
So, we got that situation resolved. They let us go back there.
Yep.
I was trying to give this place, like, the benefit of the doubt. They had a nurse there who does not have the best bedside manner, and she said a lot of snarky comments. So
the nurse is kind of getting under our skin, whatever, no big deal. The doctor comes in.
He did a couple things to irk Paul and me, but the main thing that he did, guys, prepare yourself for this. We were getting to the referrals aspect. And I told him, you know, I need several referrals because I can't see my cardiologist. I can't see my pulmonologist without any of these things. And he did not want to give it to me.
Nope.
Did not.
He literally said, I don't give any referrals on the first visit.
Yeah. And he said no medication either, so.
And she was running out of some of her medication. He's like, yeah, we don't do refills. We don't do this. We have to do so much more workup before we can say where we need to send you. Even though she has an established history at some of these doctors for years. They're like, if I don't see a problem to send you there, I'm not going to give you a referral to go there.
You did say that. And mind you, whenever I go to a doctor, established patient, and the doctor diagnoses me, I make sure, please write me a letter, say your thoughts, and write the diagnosis. And I've had all my doctors willing to do that. I gave them this information. I'm like, you could call this doctor, and they say, please call if any questions. He was not having it. It was fine. But I got to my breaking point when I asked for a referral for the gynecologist. It got to a point he said he wasn't going to give me any medications, no referrals. Then I was like, well, I do need one at least for the gynecologist. Mind you, we didn't have insurance mainly for practically a whole year. I needed to get checked up, you know. And in that area, of course, I need to see a specialist because I've had issues in the past. This doctor wanted to tell me that his office can do everything a gynecologist's office can do. And
like they could do pap smears in the office.
Yeah.
But this is not regular workup. Janice needs to go see a gynecologist. And when she asked for it, he said, why? Like in a snarky, he's like, why? You don't need that.
When he said it like that, I kind of broke out and I was like, the advocating side came out.
I took a step back. I was like, ooh, she got this one.
And I said it nicely with all due respect. And I said, with all respect, I don't think a male such as yourself should tell a female like me what I can and cannot do with my vagina, who can and cannot see it. I was like, and I'm sorry, I don't feel like I'm comfortable with your office. And some people, it depends on their preference. For me, I like a female gynecologist. Teach his own. And once I said that, he backed up. He was like, oh, no, yeah, let me write it for you. Because when I put it like that for him, he was like, oops, that didn't come out right.
So with my visit, it went even a step above that. So we went into the office. It was really cold that day. Janice stayed in the car, and I checked in, and the lobby was full. So I was like, here, I'll just text you when I'm getting called back so you can come in with Orion and we can, you know, do my appointment together. And, you know, I checked in about 10 minutes, they called me back. I called Janice, I was like, hey, they're calling me back. I'm going to be in room 5, wherever they took me. I let the nurse know, I was like, hey, my wife is outside. I do want her in the room with me. She's like, same nurse as last time. She's like, oh, okay, we'll ask the doctor. And I said to her, I was like, no, it's not ask the doctor. I want my wife back here. So she went out, told another nurse, and they're like, okay, she's coming. I was like, okay, whatever, no big deal. The nurse starts asking me some questions, and Janice texts me like, they're not letting me back there. I was like, okay. I stopped the nurse. I was like, excuse me. I want my wife back here. Yeah, but it's the dog, and we need to know if it's okay if you want her back here. Now, while this is all going down with Paul, I'm coming in, and I go to the desk, and I was like, hey, my husband's in this room. I'm going back there. Well, they look at me, and then they look at Orion. And then they're like, oh, well, let's see if you're allowed back there. Okay. I'm like, why wouldn't I be allowed back there? I'm sorry. Everybody's relationship is different, but he's my other half. Wherever he goes, I go too. Vice versa. So for me, I feel like I have all the right to go back there. And if he says no, he doesn't have a home to sleep at. Mind you, I was telling them, hey, I want my wife back here. She's in the front lobby. And they're like, yeah, we're working on it. No, they weren't. They were doing everything possible to stop me. Continue the doctor's appointment without her coming back there. So while this is going on, I see what they're doing. They give me the excuse first of, well, you can't go back there because he needs to be there alone with the doctor. I'm like, no, that's not going to work out, and I know he's asking for me. Which, mind you, we have never had any doctor in any of these appointments we've ever gone to in these last few years ever say, I only want to speak to the patient. If there's family members, they're more than willing to accommodate and be like, yeah, I'll explain this to everybody so we're all on the same page. I don't know what happened. After a few minutes, the mood changed, and then they start saying, well, we don't know if the dog's allowed back there. Okay, so is the issue me or the dog? And then they go on to get their office manager, and she's telling me that I cannot have my dog and that my husband is pretty much possibly not going to allow it either in the office. Which we live together. So yeah, I don't want the dog in my doctor's office appointment, apparently, to them. And I told her at this point, I was just like, look, if he really doesn't want me back there, he's going to have more issues at home. Do you think that's smart? And she's just like, I don't know.
Then she went on to asking me for training records, like hours, logged in and logged out for Orion.
And which, if you don't know, is illegal.
And I was just like, that doesn't exist. And at this point, I'm getting hostile. And I'm like, I'm not answering anymore. I'm not doing this. Get me back there. Point blank. And I'm telling them, I feel like when I use this example, it clicks in people's brains. I'm like, if I had a wheelchair, would you say no to my wheelchair? And she's like, no, he's my wheelchair. Still let me back there. And she's like, oh. Something happened and they finally let me back there. And of course, as I'm going back there, the same nurse that I saw made a snarky comment. She's like, oh, so you guys both have to be at each other's appointments? You guys can't speak for yourself? Me and Paul, you know, took a breath. We're like, no, we like each other there. Done. But half of me was like, if she says another comment, I'm not going to hold back. Now proceeding with the actual doctor appointment. This is just getting in there.
Yes.
What happened, Paul?
This was a different doctor than what Jenny saw.
Mind you, my doctor was a pushover considered to Paul's doctor.
Yes. This doctor, he was nice. He sat down, they had the computer, he starts reviewing, and he asked me, okay, so what's your medical history? I explained to him in a few details, like what I've gone through, different, you know, procedures, treatments, so on and so forth, updates, medications I take. And the doctor's like, okay, no problem. So we're going to get you to do some blood work. And I was like, okay, that's perfectly normal. You know, they want to check levels, whatever, so on and so forth. And I then explained to him, I was like, okay, so I do need a couple of refills because, you know, I'm running out. And then I need a referral to go see my GI, which I had an appointment to see them. And I had to cancel it because of, like, your insurance will not pay for it unless you have a referral. So I was like, okay, so I told him, I was like, hey, I need a GI referral. And he instantly came up, we don't do referrals on the first visit. And I was like, okay, that's fine. I need this because I have appointments set up and I have established history with these. The guy started fighting me back. Finally, after like 5 minutes of talking to him of why I need it, he's like, okay, fine, I'll give it to you, but I know the insurance isn't going to pay for it. And I was like, I don't care. I don't need your expertise in insurance and financial and billing. I just need you to write the referral saying you need to go see a gastroenterologist. That's it. He did not want, I literally was like ripping teeth out of him to get this one referral.
One, he wouldn't allow any other referrals. I asked, okay, he needs to see a dermatologist. Last year, he didn't get a skin check and they made it pretty big. He must get it checked out. Again,
I'm at higher risk for cancer because of the medications I take. So he literally said, why do you need a dermatologist? And I explained to him, and then he goes, well, I'll check your skin. If I don't see anything that needs to be seen by a dermatologist, I'm not going to write you a referral either for a dermatologist. Apparently, a primary care is a dermatologist and expertise in all of that, too. He started getting rude, you know, very short, very quick with me, and I was getting very frustrated.
And mind you, I'm trying to help and, you know, give some answers as well, and he didn't want me to talk.
Goodness.
Yeah, and the medication Paul was asking for, he didn't
It's over-the-counter medication. It's like stuff that I can literally go buy at CVS or Walgreens, but I get it because it's a slightly higher dose through my prescription, and the insurance will pay for it. You see what I mean? That's why. And it's nothing, I'm not asking for hydrocodone. I'm not asking for prescription narcotics or anything. Wow. It's basic medication that you can literally buy over the counter.
And then he gave us also the excuse why he couldn't give a referral and a medication on the first appointment because apparently the FDA would.
No. He said the insurance wouldn't pay for it, and then that there has been new laws about writing prescriptions for certain medications. That it has to be prescribed by a specialty doctor or specialist. And I'm just like, that makes no sense because I'm not asking for narcotics. I'm not asking for anything super high end. You know what I mean? So
this doctor hasn't checked Paul yet. This is for a physical. And what happened, Paul?
So, you know, they check your throat, your mouth. They, you know, a little scope in your ears and check it. My left ear was fine. When he went to my right ear, he said, okay, do you use Q-tips to clean your ears? I was like, no, not really. And he goes, okay, you have a very large ball of wax inside your ear. And I was just like, okay, should I get an ENT, something to get my ears clean, something? I don't know. He's like, no, you'll be fine. This was like a couple weeks ago. Yesterday, I was home and I just scratched my ear, and out of nowhere, I could not hear out of my right ear. Like, it was like you have a water log, and I was like, like snapping. I was like, are you like, what's going on? Like, why am I going deaf in my right ear out of nowhere? And Janice was like, okay, here, let me see. And then she sees a whole bunch of wax in my ear. So her and her mom, they did.
No. Paul's like, I mean, this was a lot. I mean.
Yeah, like it was a lot.
I couldn't handle it. Thankfully, my mom was home, and she has a child who's had ear issues all her life, so she was able to handle what Paul was dealing with.
So one way to clean out your ears, and they do this for kids, you know, who move a lot and they're young, they do just hydrogen peroxide. So you lean on one side, you put a few drops of hydrogen peroxide, it's going to fizz, but it's going to loosen all of the earwax up, and the fizzing is going to help push the earwax out so you can clean it out.
Fun little tip, guys. That's what my mom did to me.
I laid in bed, you know, leaned over, just put on something on my phone because I had to lay there for like 5 minutes sideways, and they removed a thing of earwax that was disgustingly large. I'm sorry if this makes you queasy, but it was so big that I looked at it and I instantly started getting so pissed and irritated because if a doctor saw that in my ear and said, "You'll be fine," and I started going deaf from how much earwax was in my ear. I started getting so pissed because I was like, you have got to be kidding me that this doctor saw this inside my ear and said, "You'll be fine."
Yeah, do you want him to check your skin now? He's gonna see something huge. He'll be fine. Just rub some lotion on it. Oh my goodness.
So those are some of our experiences with this office. And needless to say, I also filed a complaint with our insurance company. If you do not know this, if you have a very big issue with a doctor's office like this, you can call the customer service line of your insurance company, because what they can do is they can then review if they have multiple issues and then eventually get these people off of their plan, because the insurance company doesn't want to deal with doctor's offices that are very problematic and giving patients problems. They don't want to send people to a place that's giving patients problems.
And makes them worse. More money out of their pocket.
Exactly.
We have never been treated so horribly. And, you know, we are unique cases. We do have a little bit more knowledge than the average person. And
which is usually met with more
praise.
Respect, praise, and people go, "Wow,
love it.
You're helping me, thank you." So doctors don't have any guesswork. This office and these doctors are looking at us like we are the problem.
We need to shut up. That's what they want us to do. So guys, that was a little bit of our doctor's update as well. We are in the midst of trying to get something better. Like, we really are, because for our conditions, this type of insurance and
these offices are not gonna cut it for us.
No, it's really not.
Because imagine, and this is another thing, they said the referral, like if I get referred out to a GI, for example, that referral is only good for 3 visits to the GI. Mind you, I see the GI once every 4 to 8 weeks, depending.
Yeah, so we're gonna figure something out, and we'll let you guys know. So once again, guys, every day there's gonna be a vlog because we're in coronavirus lockdown. Quarantine lockdown, which one's a better word? I don't know. Keep watching and we'll keep you updated and show you guys what's the crazy shenanigans we are going through. So guys, for now, see you later, and adieu and goodbye.